Tyrone Bowman live. Welcome to the program on this evening. With vaccines on the rise, apparently, I just read an article in the Wall Street Journal. So I want to talk to you about it. It says, the FDA approved new COVID vaccines. Should you get one? Public health officials say everyone, but especially older people, should get them. So let's talk about it on today. The approval of new COVID vaccines by the FDA, or the Federal Drug Administration. So according to the Wall Street Journal, new COVID-19 shots are on their way, leaving plenty of time to get them before respiratory illness season this fall. The Food and Drug Administration on Thursday gave Moderna, as well as Pfizer and its partner BioNTech, the green light to roll out their new shot in the coming days, both of which target an offshoot of Omicron known as the KP2 strand. The two shots will be available to everyone over 6 months of age, a move that comes as COVID hospitalizations continue to climb and remain higher than they were at this time last year. According to data from the Centers for Disease Control and Prevention, doctors say everyone who is eligible should get a shot, but older people who have skipped other recent vaccine updates should especially consider it. Quote, I saw a lot of people in the hospital who got a lot of shots in the beginning of the pandemic and then didn't get any shots for a year or two years, close quote, said Dr. Peter Ching Hong, a professor of medicine at University of California, San Francisco, and infectious disease specialist. Despite recommendations last year that everyone 6 months and older receive a COVID-19 shot, a majority of Americans skipped out. Only 22.5% of adults and 14.4% of children had gotten the most recent shots as of May, CDC data showed. Ready to get vaccinated as soon as shots become available, doctors say timing is everything. Quote, unless you're very concerned about acquiring COVID right now, my recommendation would be to get it in September or October, close quote, said Dr. William Schaffner, a professor of preventive medicine at the Vanderbilt University School of Medicine, close quote. That will provide, or quote, that will provide the best protection throughout the winter season, close quote. The CDC recommended people get one of the new vaccines by the end of October. Both will be available at local clinics and pharmacies. People who recently got COVID-19 shots or recently got infected should wait around 3 months before getting an updated vaccine, doctors said. Those who are immunocompromised can get extra doses of their vaccine throughout the year, but the CDC is still weighing whether to advise the same people older than 65 years old. Quote, unfortunately, COVID has continued to circulate year-round, close quote, said Dr. Kelly Moore, president of Immunize.org, a Minnesota-based nonprofit that advocates for access to vaccines. Quote, we still are trying to figure out the right timing and cadence, close quote. If people want the continuance or the convenience of having to roll up their sleeves once, they can get both flu and COVID shots at the same time. For seniors 75 years and older who haven't previously received an RSV vaccine, doctors recommend adding this shot to the list of vaccines for respiratory illness season this fall. They can also get this vaccine at the same time as the flu and COVID shots, doctors said. Most insurance plans fully cover COVID vaccines with no extra out-of-pocket expenses for patients. And uninsured children can get immunizations free via the Federal Vaccines for Children's program. But for uninsured adults, finding a free shot might be more difficult this year. The federal program that provides adults with free COVID vaccines comes to a halt at the end of August. People can check to see whether their state or local health departments are offering free shots. And the CDC is providing some state and local health departments with funding for vaccines. throughout or through an older program. Moderna said it is donating free doses to some nonprofits that serve free clinics. Still, local funding for vaccines is limited, Moore said. Quote, at this point, we don't have a lot of good options for uninsured adults, close quote, Moore said. The FDA approved the new COVID shot based on laboratory data from the companies that showed they performed well against several strains of the virus, as well as evidence from older versions of the vaccines about how well they worked in humans. Novavax is also making a COVID vaccine for the fall, but the FDA hasn't approved it yet. The vaccine targets a different strain of the virus, JN1, but the company has said it protects against other variants as well. I'm Tyrone Bowman. Never surrender, never quit. That's your prerogative.